talking about some foundational concepts for working on core coordination and the ability to return to some higher level exercises. So there's a few things that I'd like to just point out before we start. And the first one is that you can see Autumn's using a yoga blanket to support the curves of her neck and her shoulders a little better. It's probably also helping her slightly bring her rib cage into a better alignment. And so if you're lying flat on the yoga mat and you feel like you're hyperextending your neck, or that there's a lot of pressure in your shoulders, or that your rib cage may be popping up, that would be a good indication that you might need a little more support beyond just the yoga mat. Good, and now you can see from ear to shoulder through rib cage through pelvis, she's just in a really nice alignment. So the second piece that we oftentimes talk to our clients about is this additional support that's going to go into the lumbar spine. And so this is just a hand towel that's folded into quarters lengthwise. And so I'll have her bridge up, I'll slide that right into the curve of her low back. And then when she comes down, it should just feel like it's filling in that space. And we'll talk a little bit more about that in just a moment. So right now I'm looking here at her rib cage and making sure that it's not flared up. And now we're going to talk a little bit more about this lumbar curve and the pelvic positioning. So if she were to trace from her front hip bone to her back hip bone to her pubic bone, that makes a triangle. And so one of the things that we want to be careful with when we're doing these exercises is any excess shifting of that triangle. So for example, if she were to tilt her pelvis backward, you can maybe see, or if you're doing this along with us, you can feel that her pubic bone is too high, and that puts a lot of pressure in her lumbar spine, and now her back is pushing too hard down into that towel. The opposite could be true if we're doing exercises that are a little too challenging. That pelvic triangle can tip the opposite direction, and then she has a big curve in this low back, and her rib cage even came up a bit. So we want to avoid that as well. That's why this towel is really nice. So right now the pressure that she has between her back and the towel is the pressure she wants to maintain throughout the entire exercise. Another thing that might help is sometimes we put hands, fingers toward pubic bone, palms toward hip bones to really kind of assess if that pelvic triangle is rocking too much during the exercise. Another thing that might help would be just a low hand position on the belly and on the rib cage as well. So right now, we're setting up the foundational pieces of alignment in order to optimize how well these muscles are contracting and functioning. And so the muscles that we're kind of concerned with at this point are respiratory diaphragm, deep abdominal muscles, and pelvic floor. And right now, those things are lined up really well. So the first thing we're going to do is just have Autumn practice breathing with her diaphragm. So she's going to take a nice inhale and feel her rib cage expand. We have another video on diaphragmatic breathing. If you're not quite sure what that should look like or feel like, that would be a good resource to check out. The second thing we're going to do now is we're going to have her engage her reflexive core. And so again, she's just going to take an inhale. She's going to open and release her muscles in her belly, and she's going to exhale, and as she exhales, she's going to feel this sort of corseting of her center. And inhale, open and release, and exhale, stabilize. Once you have these concepts down, it's time to add a little bit of movement. And so the first movement that we're going to do is a marching movement. So I'm going to have her inhale, open and release any muscle tension, Exhale to stabilize. And now without moving her pelvic triangle and without taking pressure off the towel and without lifting her rib cage, we're going to have her march one leg up. No. Good. And so what we're looking for is that her hip points stay level. We wouldn't want to see one hip point of the front of her pelvis drop down. Good. And now I would have her inhale, open and release as she brings the leg down. And we'll set it up for the other side. So inhale, exhale, and nice, slow, controlled lift. Nothing's moving except the hip. Good. And then lower back down. So that's level 1. Level 2 is going to be what we could call a heel slide. And so we were just working on the ability to control all of this with hip flexion. Now we're going to work on it for when we're extending our hip. So the breath work and the stabilization stays the same. Inhale with that diaphragm. Exhale, stabilize. And she slides one heel out.
With the wall in the way. Mm-hmm. That's okay.
And inhale to bring back in. And good. That would be 1 repetition. So sometimes you could do multiple repetitions on one side, so you could take the right leg in and out 10 times, or you could alternate legs as well. So Autumn is now going to demonstrate some modifications for this. So if you feel like you don't have good control when you're working this level 1 or level 2 exercise, there are a few modifications that might be helpful.
So the main modification that you can do, and the reason why we're close to the wall here, is because of the wall can be a wonderful prop if you're noticing that you just can't quite get your foot off the floor without your pelvis tilting or your ribs lifting. And so this modified exercise starts with your feet on the wall. And they could be up at 90 degrees. They could be down a little bit farther. Okay. You could also even, I'll show you the midway point. I find the in-between of your feet being on the floor and feet being on the wall. Okay. And this just winds up basically giving you a head start in getting that leg up. Okay. So you would do the same level 1 and level 2 exercises of inhaling, exhaling, lifting a leg. Inhaling, exhaling, lifting the other leg. And then once this modification starts to feel like you can do it with ease, then you can slide your way back out from the wall. Level 2 would be very simply positioning your heel on usually it works best to do it on a fridge or on a door, where you're sliding your foot up and down the wall as you do your work. The other modification that you can do, could you hand me the yoga belts? Is you can do some active assisted motion with the help of a strap. So if it feels like you need to back off some more to really respect your body's need to stay in alignment with this exercise, you can have your elbows on the floor, hands up on a yoga strap, and use that yoga strap to help you with the exercise. Just until you get to that point where you can do it comfortably and with ease. And those are the couple of modifications that you can do.
All right, so if you have any questions on that, just let us know. Good luck.